Hello everyone, welcome back to another video. My name is Casey Miller. I am an OBGYN physician and I have been using this channel to create resources and tips for current and future OBGYN residents. If you have ever rotated on the obstetric or gynecologic service as a medical student, you will know that there are many abbreviations or acronyms that we use in this specialty. It can be pretty overwhelming, especially if you are a student, an MS3 or an MS4 even, or even if you're an off-service resident like in family medicine who is coming to the service to do some rotations and get some deliveries. Today I'm going to do a rapid fire review of all of the most common acronyms that you are going to see on this service. Most of these, but not all of them, are approved by ABOG, which is another acronym, of course, which stands for the American Board of Obstetricians and Gynecologists. If you would like to review the formal list of approved acronyms, I will link it in the description box below. Technically, as OBGYNs, we are supposed to only use the approved abbreviations. However, having rotated in different hospitals as a student and different private practices as well as a student, and then now having gone through residency, I've seen that there are some abbreviations that are just going to be native to the institution that people just kind of get because you work there. So make sure you check out that list of actually approved abbreviations. Those are going to be the ones that when you finish your OBGYN residency and you have to take your oral board exams, when you submit your case list, you are only allowed to utilize the acronyms from the approved list. So let's jump in and start with the most common acronyms or abbreviations for obstetrics. SROM, spontaneous rupture of membranes. PROM, premature rupture of membranes. PPROM, preterm premature rupture of membranes. AROM, artificial rupture of membranes. FSE, fetal scalp electrode. IUPC, intrauterine pressure catheter. FHR, fetal heart rate. FHT, fetal heart tones. DVP, deepest vertical pocket. MVP, maximum vertical pocket. They're the same thing. GBS, group B strep. IOL, induction of labor. TOLAC, trial of labor after cesarean section. VBAC, vaginal birth after cesarean section. VAVD, vacuum assisted vaginal delivery. NSVD, normal spontaneous vaginal delivery, or SVD, drop the N and make it spontaneous vaginal delivery. PCS, primary cesarean section, although in some places you might see PLTCS, which stands for primary low transverse cesarean section. Similarly, RCS, repeat cesarean section. RLTCS, repeat low transverse cesarean section. PPH, postpartum hemorrhage. PTL, preterm labor. VB, vaginal bleeding. CTX, contractions. IUFD, intrauterine fetal demise. IUP, intrauterine pregnancy. EFW, estimated fetal weight. EGA, estimated gestational age. AB, abortion. SAB, spontaneous abortion. TAB, termination abortion, or EAB, elective abortion, same thing. BTL, bilateral tubal ligation. FGR, fetal growth restriction, which has replaced the former IUGR, which is intrauterine growth restriction. They're the same thing. OP, occiput posterior. OT, occiput transverse. OA, occiput anterior. ROA or LOA, right occiput anterior, left occiput anterior, same thing. LOT, ROT can be used the same way. ROP, LOP can also be used the same way. US for ultrasound. And those are the main ones that I can think of for obstetrics, so let's move on to gynecology. Starting with the classic, LMP, last menstrual period. D&C, dilation and curettage. D&E, dilation and evacuation. IUD, intrauterine device. CIN, cervical intraepithelial neoplasia. LSIL or LSIL, low-grade squamous intraepithelial lesion. Similarly, HSIL, high-grade squamous intraepithelial lesion. ASCUS or ASCUS, atypical squamous cells of undetermined significance. HCG, also a classic, human chorionic gonadotropin. HPV, human papillomavirus. ECC, endocervical curettage. EMC, endometrial curettage. EMB, endometrial biopsy. LEEP or LEAP, loop electrosurgical excision procedure. Along with that goes CKC, cold knife cone. HRT, hormone replacement therapy. TLH, total laparoscopic hysterectomy. TAH, total abdominal hysterectomy. TVH, total vaginal hysterectomy. LAVH, laparoscopic assisted vaginal hysterectomy. Whew. I know that's a lot. I hope this video helps if you are going into your OBGYN rotation. Like I mentioned before, feel free to check out that list from ABOG of the approved acronyms. If you have seen any other ones and you're not sure what they mean, feel free to leave a comment and I will do my best to respond. Otherwise, I will see you next week in another video, and happy holidays.